Hi everyone, I am Roslyn Anita, lecturer in Tribhulam College of Nursing. Today I am going to present about hormonal therapy. So the hormonal therapy is a treatment method that uses hormones or blocks hormones to manage different diseases and conditions. It is commonly used in cancer treatment, menopause management, reproductive disorders and endocrine diseases. In this presentation, we will discuss the definition, types, indications, benefits, side effects, and nursing responsibilities related to hormonal therapy. So, the objectives are introduction, physiology of hormones, types of hormonal therapy, indications of hormonal therapy, hormone replacement therapy, hormone therapy in cancer, hormonal therapy in menopause, and routes of administration, advantages of hormonal therapy, side effects of hormonal therapy, contraindication and precautions, nursing responsibility, patient education, and conclusion. Coming to introduction, definition. Hormonal therapy is a treatment that alters hormone levels in the body. It may add hormones, replace deficient hormones, or block hormone action, used for both medical and therapeutic purposes. So, the main goals are restore hormonal balance, control the hormone dependent diseases, and improve quality of life and reduce symptoms caused by hormonal imbalance. So, the hormones are chemical messengers produced by endocrine glands. They regulate many body functions such as growth, metabolism, reproduction, and mood. So, the hormonal therapy works by increasing, decreasing, or blocking hormone activity. It is important in modern and medicine because many diseases are influenced by hormones. Coming to the physiology of hormones. So the hormones are produced by pituitary gland, thyroid gland, adrenal gland, pancreas, ovaries and testes. The functions of hormones. It regulates metabolism, control the growth and development, and maintain reproductive function, balance the mood and emotions, and maintain fluid and electrolyte balance. So the endocrine system is responsible for hormone production. Hormones travel through the bloodstream and act as a target organs. Even a small imbalance in hormones can affect many body systems. Understanding hormone physiology help healthcare professionals understand why hormonal therapy is necessary. Coming to types of hormonal therapy. The first one is a hormonal replacement therapy, HRT, that is replace the deficient hormones. And second one is a hormone suppression therapy, it reduces the hormone production. And third one is a hormone blocking therapy, prevents hormones from acting on cells. And fourth one is a hormone stimulation therapy, stimulates hormone production. So different hormonal therapy are used in depending on the conditions. Hormonal replacement therapy is a common in menopause and endocrine disorder. So the hormone suppression and blocking therapies are mainly used in hormone sensitive cancers such as breast and prostate cancer. Coming to indication of hormonal therapy. So the hormonal therapy is used in breast cancer, prostate cancer, menopause, hypothyroidism, infertility, polycystic ovarian syndrome, endometriosis, delayed puberty, gender affirming treatment. So the hormonal therapy is used in many medical conditions. Some diseases occurs due to lack of hormones while others worsen because of excess hormones. For example, breast cancer may grow faster in the presence of estrogen, so hormone blocking drugs are used. Coming to hormone replacement therapy, that is HRT. The definitions are therapy used to replace the missing hormones. Commonly used hormones are estrogen, progesterone, testosterone, thyroxine and insulin. They uses menopause management, hypothyroidism, diabetic mellitus and hypogonadisms. So the hormonal therapy replacement therapy is commonly used when a body does not produce enough hormones. For example, insulin is used in diabetes and thyroxine is used in hypothyroidism. So in the menopause woman, estrogen therapy helps reduce symptoms like hot flushes and osteoporosis. Coming to hormonal therapy in cancer. Breast cancer. Tamoxifen aromatase inhibitors. Coming to the prostate cancer, anti-androgen drugs, GnRH and antagonist. And purposes are stop cancer growth, prevent spread of cancer, and reduce recurrences. So some cancers depends on hormones for growth. Hormonal therapy blocks or lowers these hormones. Tamoxifen blocks estrogen receptors in breast cancer. In prostate cancer, testosterone suppression slow tumor growth. So the hormonal therapy may be used alone or with surgery, chemotherapy or radiation therapy. Coming to hormonal therapy in menopause. The symptoms of menopause are hot flushes, night sweats, mood swings, vaginal dryness, osteoporosis risk. The benefits of therapy: reduce symptoms, improve sleep, protect bone health, and enhances quality of life. So the menopause occurs due to decreased estrogen production. Hormone replacement therapy helps reduce uncomfortable symptoms and improve the daily functioning. However, therapy should be carefully monitored because prolonged use may increase certain health risk. Coming to the routes of administration. So hormonal therapy can be given through oral tablets, injections, skin patches, creams and gel, implants, nasal sprays, vaginal preparation. The route of administration depends on the type of hormone, patient condition and duration of treatment. Oral medication are common, but patches and injections are also widely used. Some methods provide slow and continuous hormone releases. Coming to the advantages of hormonal therapy. The benefits are effective symptoms relief and improve the hormonal balance, and non-surgical management option and slow progression of hormone dependent cancers, and improves the fertility in some patients and enhances quality of life. So the hormonal therapy provides major benefit in many patients. It may reduces symptoms, improve the physical and emotional health, and help control chronic diseases. In cancer treatment, it can significantly improve survival and reduce recurrences. Coming to side effect of hormonal therapy. The common side effects are weight gain, nausea, mood changes, fatigue, headache, hot flushes, acne and fluid retention. Serious side effects are blood clots, hypertension, liver problem, increased cancer risk in prolonged therapy. So like all treatment, hormonal therapy can cause side effects. Some are mild or temporary, while others may be serious. So the patient should be monitored regularly to detect complication yearly. So education about the side effect is an important nursing responsibility. Coming to contraindications and precautions. Contraindications. So the pregnancy in certain therapies, active liver disease, history of thromboembolism and hormone sensitive cancers in some cases. Precautions are regular follow-up, monitor blood pressure and assess liver functions and evaluate the patient history carefully. The hormonal therapy is not suitable for everyone. Before starting treatment, healthcare providers must assess patient history, current diseases and risk factors. So the proper monitoring helps prevent complication and ensure safe treatment. Coming to nurses' responsibility. So, the nursing care includes assess patient condition, monitor vital signs, educate patient about therapy, and observe for side effects, encourage medication adherences, provide emotional support, maintain proper documentation. So, the nurses play an important role in hormonal therapy management. They monitor patients, provide education, and ensure safe administration of medication. So, the emotional support is also important because hormonal changes may affect mood and mental health. Coming to patient education, so the important instruction for patients: take medication as prescribed, do not stop therapy suddenly, attend regular medical checkup, and report unusual symptoms immediately, maintain healthy diet and exercise, avoid smoking and alcohol. So, the patient education improves treatment outcomes and reduce complication. Patients should understand the importance of regular follow-up and medication compliances. Lifestyle modification can also improve the effectiveness of therapy. Coming to the conclusion, hormonal therapy helps manage many diseases. It can replace, suppress, or block hormones. Widely used in menopause, cancer, and endocrine disorders. Requires careful monitoring and patient education. So, hormonal therapy is an important medical treatment that improves health and quality of life in many patients. Although it has several benefits, careful monitoring is necessary to prevent complications. Nurses and healthcare professionals have a major role in patient care and education. So the references are Lewis and Renner and Siddharth and Kadzak. Thank you.